What if your body was trying to warn you about cancer, but you just weren't listening? Imagine for a moment that simple changes in the smells you experience every day could be early signs of something much more serious. Often, we ignore these signs, thinking they are nothing to worry about. However, these changes in smell can actually be vital clues, helping to catch cancer early when it's most treatable. Today, we'll explore how certain smells that you might not pay much attention to could be alerting you to cancer. Knowing what to sniff out can make a big difference. It's time to pay attention and understand how your body tries to communicate the risk of cancer through the simple act of smelling. This knowledge isn't just interesting, it could potentially save lives. A moldy or musty smell coming from the mouth is something most people wouldn't think twice about. However, in some cases, this unusual smell can be an early sign of mouth or throat cancer. The odor itself is often compared to the smell of damp wood, mildew, or something stale. This happens because cancer in the mouth or throat can cause tissue damage and infections. As the tissue breaks down or becomes inflamed, it releases certain chemicals that produce this musty scent. One reason this smell appears is due to tumors in the area. These tumors can grow and press against nearby tissues, causing wounds or sores that don't heal properly. When this happens, bacteria can grow in those areas, making the odor even stronger. In some cases, the cancer can also lead to necrosis, which is when tissue starts to die. This process creates a buildup of compounds that carry this unpleasant smell. If someone notices this smell on their own breath or from someone close to them, it's important not to dismiss it as just poor hygiene or a dental issue. Pay attention to other symptoms that might appear along with the smell. These can include a sore throat that won't go away, difficulty swallowing, or persistent hoarseness. Other warning signs might include red or white patches in the mouth or throat, mouth sores that don't heal, and even unexplained ear pain. If this smell is present along with any of these symptoms, seeing a specialist is critical. An ear, nose, and throat doctor or an oncologist can perform the necessary tests, like a biopsy or scans, to check for any abnormalities. The earlier the diagnosis is made, the better the chances of successful treatment. Early detection can make a life-changing difference because when mouth or throat cancer is caught early, there are more treatment options and higher chances of recovery. Ignoring a musty breath smell, especially when it is consistent and unusual, can lead to delays in diagnosis. This is why being aware of changes in your breath or mouth health is so important. Even if it turns out to be a minor issue, it's always better to be cautious and get checked early rather than wait until the problem becomes more serious. A decomposition-like smell from bowel movements is not something people usually associate with cancer, but it can be an important warning sign of colorectal cancer. This smell is often described as much stronger and more unpleasant than the usual odor. It can resemble the scent of rotting or decaying material, and unlike the normal variations caused by diet or certain foods, this smell tends to be persistent and hard to ignore. The reason this odor occurs is because colorectal cancer can disrupt the normal digestion process. When a tumor grows in the colon or rectum, it can block or slow down the passage of food through the intestines. This slowdown can cause food to sit longer in the digestive tract, where it breaks down and releases more gases and toxins than usual. These chemical changes lead to a smell that is far more foul and lingering than usual. The tumor may also cause inflammation or infections that further contribute to the strong, unpleasant odor. In some cases, bleeding within the digestive tract can also add a metallic or decomposing scent to the stool. If someone notices this persistent and abnormal smell, it's important to pay attention to other signs that might appear along with it. These can include blood in the stool, unexplained weight loss, frequent abdominal pain, and changes in bowel habits, such as constipation or diarrhea that last for several weeks. While some digestive issues are common and can be linked to less serious conditions, the combination of these symptoms, especially the strong decomposition-like odor, should not be ignored. If you or someone you know experiences these signs, it's crucial to consult a doctor right away. A simple stool test, colonoscopy, or imaging scan can help detect potential problems early on. When colorectal cancer is caught early, it is often highly treatable, with a much better chance of recovery. Ignoring a bad smell from the stool, especially when paired with other symptoms, could lead to delays that make treatment more difficult. By acting quickly, you can take an important step toward protecting your health. A sweet yet unpleasant smell coming from the skin or wounds in the breast area can be an early clue that something isn't right. This odor is often described as having a sugary, sickly scent mixed with a foul undertone, and it can sometimes resemble the smell of decaying fruit or spoiled sweets. While this smell is not always a sign of something serious, it can appear in more advanced cases of breast cancer, especially when tumors cause tissue breakdown or infections. In cases of advanced breast cancer, tumors can grow to the point where they affect the surrounding tissue, causing inflammation or even open sores. When the skin breaks down, bacteria can invade the area, leading to infections that produce this distinct smell. Tissue necrosis, where parts of the tissue begin to die, can also release compounds that contribute to this sweet but unpleasant odor. In some cases, people may mistake this for poor hygiene or a mild skin infection. But when the smell is persistent despite good care and hygiene, it can be a sign that medical attention is needed. If someone notices this smell, it's important to check for other symptoms that may appear alongside it. These include lumps in the breast or armpit, changes in the skin texture like dimpling or thickening, unusual discharge from the nipple, and persistent pain or irritation in the area. If there are any open wounds or sores on the breast that won't heal or that leak fluid with a strong odor, this should be taken seriously. The first step upon noticing these changes is to schedule a visit with a healthcare provider. A physical exam, mammogram, ultrasound, or biopsy may be necessary to determine the cause of the symptoms. Catching breast cancer early, even when it presents unusual signs like a strong smell, can make a significant difference in treatment outcomes. The longer such symptoms go unchecked, the higher the chance that the cancer could spread or become more difficult to treat. Always trust your instincts when you notice something unusual, as early detection can lead to more effective treatment and a better chance of recovery. A sulfuric or rotten egg smell coming from the breath is a strong indicator that something might be wrong with the digestive system. This smell is often caused by the release of sulfur gases, which are produced when food isn't properly broken down in the stomach. While some occasional bad breath related to food or indigestion is normal, a persistent sulfur-like odor that doesn't go away, even with proper oral hygiene, can point to a more serious issue such as stomach cancer. Stomach cancer can interfere with the normal digestion process. When a tumor grows in the stomach, it can block or slow down the movement of food, leading to fermentation and the buildup of gases like hydrogen sulfide, which is known for its distinct rotten egg smell. Additionally, stomach cancer can cause inflammation, making it harder for the stomach to break down food properly. This can create an environment where bacteria thrive, further contributing to the release of foul-smelling gases. In some advanced cases, bleeding in the stomach can also add a metallic or acidic smell to the breath. If someone notices this type of breath odor, especially if it lingers despite brushing, flossing, and using mouthwash, it's important to look out for other symptoms. These can include persistent abdominal pain, frequent nausea, bloating, a constant feeling of fullness after eating only small amounts, loss of appetite, and unexplained weight loss. In more severe cases, there may also be blood in the stool or vomit, which appears dark or tar-like due to partially digested blood. If any combination of these symptoms appears alongside the sulfuric smell, it's critical to seek medical advice immediately. A gastroenterologist can perform tests such as an endoscopy, ultrasound, or biopsy to check for abnormalities in the stomach. Stomach cancer can be difficult to detect early because its symptoms often mimic common digestive issues. However, catching it early improves the chances of successful treatment. Don't dismiss a persistent sulfur or rotten egg smell from the breath. It could be your body's way of signaling that something is seriously wrong. Getting checked early can make all the difference. A smell similar to rotting flesh is one of the most unsettling signs someone can notice, and it may be linked to advanced skin cancer, particularly melanoma. This odor is often described as decaying or foul, resembling the scent of spoiled meat. The reason for this smell is that as cancerous cells grow uncontrollably, they can damage the surrounding skin tissue, causing wounds or ulcers that don't heal. when these wounds become infected or when tissue starts to die, a process known as necrosis. The breakdown releases volatile compounds that produce this distinct and unpleasant odor. In many cases, this odor comes from open sores or lesions on the skin that may start as small, irregular moles or dark spots. Over time, these areas can become raised, bleed, or develop a crusty surface. Some lesions may change color or shape, become larger, or start to itch or hurt. In more severe cases, the skin around the area may swell, turn red, or become extremely sensitive. Unfortunately, because skin cancer spots often appear in hard-to-see areas like the back, scalp, or behind the ears, the issue may go unnoticed until it progresses. If someone notices a persistent wound on their skin that emits an unpleasant smell, or if they see any unusual changes in moles, it is crucial to consult a dermatologist as soon as possible. A dermatologist can examine the skin closely and may recommend a biopsy to determine whether the lesion is cancerous. Early-stage skin cancer, including melanoma, is highly treatable, but if left unchecked, it can spread to other parts of the body and become life-threatening. The key to preventing severe complications is early detection. Even if the smell or lesion seems minor, it's better to be safe and seek medical advice. Catching skin cancer early can lead to simpler treatments and a much higher chance of recovery. If you or someone close to you notices a strange smell coming from a skin wound or unusual skin changes, don't wait. Getting it checked promptly could save your life. A strong ammonia-like smell in urine can be an early clue that something may be wrong with the kidneys. This smell is sharp and pungent, similar to the odor of cleaning products or stale urine. While urine naturally has a mild smell due to the body filtering out waste, an intense and persistent ammonia smell is not normal and could signal a problem. One possible cause of this unusual smell is kidney cancer, which can affect the way the kidneys filter and remove waste from the body. The kidneys play a vital role in filtering toxins, balancing fluids, and producing urine. When a tumor develops in the kidneys, it can disrupt this process, leading to the buildup of waste products in the blood. As the kidneys struggle to function properly, higher amounts of urea and other byproducts may be released into the urine, creating a strong ammonia-like odor. In some cases, blood may also appear in the urine, turning it pink, red, or dark brown. This symptom, combined with the unusual smell, is a major red flag that should not be ignored. If someone notices this ammonia smell and it doesn't go away after increasing water intake or adjusting their diet, it's important to pay attention to other symptoms. These can include lower back pain, extreme fatigue, unexplained weight loss, and swelling in the legs or ankles. While a strong urine smell can also be caused by dehydration, high-protein diets, or urinary tract infections, persistent changes in the odor, especially when accompanied by these additional symptoms, should be evaluated by a doctor. A medical evaluation can include a urine test, blood test, or imaging such as an ultrasound or CT scan to check for any abnormalities in the kidneys. Early detection of kidney cancer can make a significant difference in treatment outcomes, as the cancer is more likely to be treatable when caught early. Ignoring the signs, especially a strong ammonia smell that persists, can lead to a delayed diagnosis and fewer treatment options. If something feels off, don't wait. Seeking medical advice promptly can help catch the problem before it becomes more serious. A metallic smell coming from the breath or sweat can be an unusual but important sign of blood cancers like leukemia or lymphoma. This smell is often compared to the scent of rusty iron or old coins. Some people may describe it as a faint, coppery odor that becomes more noticeable after light physical activity or during periods of sweating. While not everyone notices this type of smell, those who do may find it persistent and hard to explain. This metallic odor is linked to changes in the blood's chemical makeup. Blood cancers like leukemia and lymphoma affect how blood cells are produced and function. As the cancerous cells grow and multiply, they interfere with the normal balance of healthy red and white blood cells and platelets. This disruption can lead to an imbalance of minerals like iron and other compounds in the bloodstream. When these chemical levels become abnormal, the body may release certain compounds through the sweat glands or breath, creating the metallic smell. Additionally, some patients with blood cancers may experience frequent nosebleeds or bleeding gums. which can leave a lingering metallic taste or smell. If someone notices a metallic smell that doesn't seem related to their diet, oral health, or hygiene, it's important to be aware of other symptoms that could point to a more serious condition. Common signs of blood cancers include extreme fatigue, unexplained bruising, frequent infections, persistent fever, swollen lymph nodes, and sudden weight loss. If several of these symptoms occur alongside the metallic odor, it's important to seek medical advice without delay. Doctors may perform blood tests to check for abnormal levels of white blood cells, platelets, and hemoglobin, as well as scans to detect swollen lymph nodes or other issues. In some cases, a bone marrow biopsy may be recommended to confirm a diagnosis. Early detection of leukemia and lymphoma can significantly improve the chances of successful treatment. A metallic smell might seem like a small issue, but when combined with other symptoms, it can be a critical clue. If you or someone you know experiences this, don't ignore it. Getting evaluated early can make a life-saving difference. A sweet, fruity odor on the breath can be an unusual but important warning sign of lung cancer. This smell is often described as similar to fermented fruit or overripe apples. Unlike common bad breath that can come from poor oral hygiene or digestive issues, this odor tends to linger and doesn't go away, even with regular brushing or using mouthwash. It's subtle at first, but can become more noticeable over time, especially when the person is breathing heavily. This fruity smell is caused by the release of volatile organic compounds, VOCs, from the lungs. When lung cancer develops, it can alter the way cells in the lungs function and grow. Cancerous cells produce waste products as they multiply, and some of these waste products are released as gases that enter the airway and are expelled through the breath. These VOCs create a unique scent that the body can't easily mask. While most people might assume this odor is related to diet, certain infections, or diabetes, if there are no other clear reasons, it could be linked to something more serious. If someone notices this persistent fruity smell, it's crucial to pay attention to other respiratory symptoms. These can include a chronic cough that doesn't improve, shortness of breath, wheezing, hoarseness, or chest pain. In some cases, people may also experience unexplained weight loss or coughing up blood. While respiratory issues can often be linked to less serious conditions, the combination of a fruity breath smell with these symptoms should not be ignored. Seeking medical attention as soon as possible is critical in these cases. A doctor may perform chest X-rays, CT scans, or lung function tests to check for abnormalities. Lung cancer is one of the most dangerous cancers because it often goes undetected until it reaches advanced stages. However, when caught early, there are more treatment options and a better chance of survival. If you or someone close to you notices a fruity breath smell that persists without explanation, don't wait. Early detection can save lives, and getting your respiratory health checked promptly is an important step toward protecting your well-being. Paying attention to your body's subtle signals can make all the difference when it comes to catching serious illnesses early. The smells we've talked about today may seem small or easy to overlook, but they could be the body's way of warning you that something isn't right. Early detection is one of the most powerful tools in fighting cancer, giving people a much better chance at effective treatment and recovery. By noticing these signs and taking them seriously, you're giving yourself or someone you care about the best possible chance at a healthier future. If you notice any persistent or unusual odors that can't be explained by your diet, hygiene, or other common causes, don't hesitate to seek medical advice. It's always better to get checked out early rather than waiting and wondering. A simple checkup could help catch a potential problem before it becomes something more serious. Your health and peace of mind are worth that extra step. We also encourage you to share this information with others. Many people may have no idea that changes in smell can be linked to something as serious as cancer. By spreading awareness, you're helping to educate others and possibly save lives. Whether it's a family member, friend, or someone in your community, this knowledge could make all the difference. Thank you for watching, and remember, listening to your body could be the most important thing you ever do. Today, we've explored some surprising and often overlooked ways your body may be signaling serious health concerns. We discussed how certain unusual smells, like a musty breath, a sweet or metallic scent, or an ammonia-like odor, can sometimes be early signs of different types of cancer. These smells are not random. They result from changes in the body's chemistry as it tries to cope with illness. The key takeaway is that your body is always communicating with you, even in subtle ways. And paying attention to these clues can lead to early detection and better outcomes. It's important to remain vigilant and proactive about your health. While not every unusual smell points to something serious, persistent changes that don't improve with normal care should not be ignored. Whether it's scheduling a doctor's visit or encouraging a loved one to seek medical advice, early action can make a life-saving difference. Regular checkups, listening to your body, and staying informed are all powerful steps in managing your health. We'd love to hear from you. Have you ever noticed a strange change in your body that led you to discover a health issue? Or do you have a personal story that could help others? Sharing your experience in the comments could inspire someone else to take charge of their health. Let's create a space where we can learn from each other and spread awareness about the importance of early detection. Thank you for being part of this important conversation. Your health and your voice matter.